open the meeting up yet. So, oh, we did?
All right, y'all. That's a southern statement. Okay, this is our afternoon work session. We already started this morning with a work session this morning, but we decided, since we have a lot of important issues to present, to do this one downstairs. So we are reconvening our work session for this afternoon. Welcome everyone who chose to join us. And our first report is going to be on opioid-focused recovery peer coach pilot program. State funding request. Sherry Corrier.
Yeah, good morning, or I did it again. Afternoon, Commissioners. Sherry Corrier, Director of Neighborhood and Community Services. I'm going to be quick. I know your schedule's a little tight, but we have an opportunity here this afternoon for Joshua Barnett, our Healthcare Services Manager, to bring forward to you the ability for us to move forward on some potential funding at the state level. I think yesterday at the legislative pancakes and politics, you heard discussion from Representative Boyd and the rest there that this is a priority. So I want to turn it over to Joshua so he can explain. Thank you.
Good afternoon.
Good afternoon.
This is my first time speaking with you all since my introduction,
welcome.
so
Oh,
thank
well,
you.
welcome.
We'll be nice.
Thank you. You may already be aware that we have an opioid work session upcoming. This was something that was brought to our attention last week, that we have an opportunity to potentially get some funds. So we would be remiss to not try to capitalize on that opportunity. So in between my relocation from Delaware over this weekend, I was tracking some notes, threw something together. But what this is something we've been thinking about. Peer support is an evidence-based practice that's been around for quite a long time. You may have heard about it in the Veterans Administration from people who have been out in the theater, who work with folks who have veterans who have post-traumatic stress disorder. You may have heard about it from the mental health community, from those who have lived experience in recovery to enhance recovery potential for those who are in early stages of recovery to seek treatment. And certainly within the addictions community, many professionals who work in the addictions community are people who are in recovery themselves. So what we're trying to do here is we did a scan of what's currently in the community. So I've been here for 3 months. I've taken a lot of time to listen to what's available, hear about the gaps in the service continuum, and every time I hear the opioid crisis is impacting us more than anybody else, and they're not wrong. It's really impacting this community. So what we have here is an opportunity to request some funds. So what I yielded to was, we have a treatment provider that's obviously limited in their ability to provide and respond to everyone in need of this resource. You are aware of Jimmy Crutchfield's group with Emergency Management Services, who administers Narcan frequently. You're aware of the death rate in Florida. 10 people a day die from opioid use disorder, and we are the county that is most impacted. So you are aware that our number is more than that. So with that terrible news to be said, what I have drafted here is a quick detail of recovery coaching. Recovery coaching is the substance use specific peer support. Peer support service is an evidence-based practice that's also acknowledged by the Substance Abuse Mental Health Service Administration, SAMHSA. And what they allow for is a substance use specific peer recovery coach to work with those who are in early addiction recovery or in later addiction recovery, or for people who find themselves at greatest risk of relapse. So it's a natural support of someone who has experience with an addiction, who has sought out how to live a life with an addiction in a positive way. So it's really a way to instill hope, inspire resilience, and to make sure that people have continued sustained recovery in the community after they leave from a jail, after they leave from an emergency department, if they leave from a detox center. So what we've heard after meeting with a number of folks is, after administering Narcan, what likely occurs is the person no longer feels like they're going to die. They then flee and go about their day, and within a matter of hours, they are then feeling the fear of detox, and they're out seeking the substance to prevent them from feeling like they are going to die. What peer support does is it provides a community-based outreach of people who understand what that feeling is like, that have found a way to get out of that cycle, to say, I'm here, I have a story, let me share it with you, so that I can show you what the alternative is. And what this is it allows for people to go without the drug for a longer period of time, stay out of the emergency rooms, and reduce the likelihood of overdose death. So let me walk you through this document a bit. That's sort of the introduction. So obviously the opioid epidemic is multifactorial. There is not one way to become dependent on opioids. Some people become dependent because of heroin use. Some people become dependent because they fell and injured themselves at work, went to a doctor, the doctor prescribed a pain management medication. To no fault of their own, they became dependent. And for whatever reason, they needed more of the drug to manage their pain, or their prescription fill was stopped, and someone said, I have some extra, let me give them to you. You're obviously having some severe pain. And then what happens later on, they might have sought out another illicit substance. Heroin is also a huge problem. Law enforcement has given me the details that there are synthetics that are coming to the area. Fentanyl is being mixed with heroin and causing the greatest impact, which is death. So by having peer support or recovery coaches, they can go out to the communities of the greatest of need and speak to these folks to say, look, there is potential to recover. I've been in meetings where law enforcement has said, can we find somebody who's battled this and won? They exist. We don't know who they are yet, but they exist because there are people who have had multiple disorders, such as opioid dependence, and have found a way to manage it either through cognitive behavioral therapy, other ways of managing their pain without the use of opiate medications, or they have detoxed. I just, on my travels, I stayed with my cousin who had a car fall on his arm. He works in a mechanic shop, and so he doesn't have insurance. And when he went to the doctor, he was prescribed an opiate. He said it was the worst thing he's ever had to get off of. The problem is he went back to the doctor's office, the same clinic, but it's a different doctor. And what they offered him was an opiate. He said, Joshua, you don't know how hard it is to refuse a medication that you know helps because it will tear your life apart. I have battled this for 2 years, and I wanted it so bad, but I can't take it. He's somebody who can inspire somebody else and give mutual support to not take this medication or not use heroin and not take the easy way of managing a very difficult problem. So, peer support with respect to evidence provides community education and awareness in the greatest of need neighborhoods here in Manatee County. We are currently conducting an analysis in preparation for our opioid work session of what communities are the most impacted, where are we giving the most Narcan administrations, and where do we have the folks who are dying the most, and where is that? These peer support, peer coaches can be out in those neighborhoods meeting with people who are in the greatest need, meeting with the families to say, look, this is a disorder. It's not a character flaw. Let me give you my story so that you can feel inspired, and let's see if we can maximize the person's recovery potential. Peer support also collaborates with jails. If they're incarcerated and they have the addiction, they can collaborate with treatment programs, and they can certainly collaborate with emergency medical services, keeping in mind that these are reactive services. They're not necessarily proactive services. Peers can also bridge the gap. They walk the line of recovery. If they are incarcerated, they can meet up with them at the jail and find out what happened. They can still inspire hope and prevent future relapse. And they can reduce the adverse effects of the opioid epidemic here by being in the communities and being present. So what I've given you here on the second page is a few descriptions of the actual service detail of what peer coaching is. So community psychoeducation is that this pilot program would intend to provide community education events, multiple. They would collaborate proactively with treatment and addiction professionals. They would collaborate with medical and pain management professionals. They would provide non-medical pain interventions, such as other coping strategies. And they would provide a harm reduction approach to recovery. What often happens is someone who is in early stage of recovery or feels the critical need to utilize this illicit substance may not think that abstinence is possible. So what this harm reduction approach provides is a reduction of the dependence over time, saying that this is not something to be fixed tomorrow. This will take time. You will have tough days. This is a disorder. Let me stand by you as you continue to pursue recovery over your individual journey. It's a bridged gap support program. Often what can occur is someone may utilize inpatient service and then fall out of service. They may be arrested someplace else and that their continuity of treatment is disrupted. They also may be marginalized from family who don't see that this is a disorder. They see it as a character flaw, and it creates division. This also has the opportunity, we've seen here from our current data sources that we're analyzing, child removal rates are tremendous in this county. District 12 of Florida is the most impacted area, and our child removal rate in this county due to this issue is escalating at an inordinate value. So I think I've given you an overview, a comprehensive overview of what peer support is. When we look at what our current service array includes, we have a treatment provider who does do detox, inpatient detox. We have an EMS service that goes out and administers Narcan. We don't have a proactive community-based intervention that guards against this disorder from impacting their lives greater. We're removing children. So what this pilot allows us to do is give us an affordable way of utilizing people who have a lived experience with this disorder to inspire others to seek treatment, to stay in treatment, and to provide hope that recovery is possible when they feel that they are literally going to die from detox of this drug. So I would like to take any questions that you might have.
Any questions for Joshua? Carol? Yeah, I'm trying to get this.
Button's not working, just, oh.
Yeah, I know, we're trying to get
Okay.
it to work.
We'll stop here.
It looks like, when I skim through this, the grant is for 500,000. And is it matching, and is this the grant that Buchanan had something to do with? Or, I know there was some kind of fundings coming down for mental health and, well, for this actually opioid problem. Is this it?
This is not it. So in the past, I've created peer coach programs and bid on those for contracts for Medicaid reimbursement in other states, and written the program and the training curricula for peer coaches. This typically is the cost associated with this service, which allows a clinical overseer to provide clinical counseling to these peer workers who go out in the community and work with people in recovery, maintain that they have knowledge of motivational interviewing skills, which is also an evidence-based practice for substance use conditions. So 500,000 would allow us to demonstrate the effectiveness of this service. It's not a great amount of money, but this could be something that the state, if they decided, could use those funds for this type of program.
So you still didn't answer the question.
I'm sorry.
Oh, no, it's okay. Is this like a grant that you're applying through a state? You found a funding source with the state to apply for some kind of block grant, and is this also outcome-based?
We would have outcome-based measures when we work with the selected provider, but I'm going to refer to Nick because
Right behind
this
you.
is this process is a little new to me. So Nick brought this to my attention, so I'm going
Okay.
to let him speak.
Thank you, Josh. Good afternoon, Commissioners. Nick Azera. The process is new to all of us this year. Speaker Corcoran, as you know, set out new rules that prompted legislators to file bills specific to every funding request. And this year is unique in that we haven't had to follow that process in the past. So we received forms from the House and the Senate within a couple of weeks ago, and along the same time, Joshua and I and Sherry and Karen Winden, we'd been talking about potential requests from the state, and so the deadline for these forms to be submitted is coming up quickly at some point next week, and so this was the opportunity, we thought, with Tallahassee's eyes on the situation. Obviously, Representative Boyd, it's got his attention. We thought it would be a unique opportunity to ask the state if they could be helpful and make a funding request. And to that extent, we would use that funding and to fund the pilot. And to the extent that the funding is available, then that determines the scope of the project.
And just to finish, so this is a block grant. This is not since we didn't get the Medicaid, is this how, another way that we're getting, not the Medicaid, but the Medicaid that we can use for block grant programs?
Right, so we keep reading about potential block grants that are coming from the federal government, perhaps in place of Obamacare. But really, that's all in discussions right now. And so think of it along the same track as the request we're making for the Rabonia stormwater improvements. That paperwork is almost ready to go. We're going to be meeting with legislators and talking about that when we travel to Tallahassee in March. And if we're able to get this paperwork into Tallahassee, if the board's agreeable to it, then Josh would probably accompany us to Tallahassee and be able to talk about the benefits of that program.
Commissioner Whitmore, can I expand upon my response from your outcomes-based question? So on the final section of the document I provided, these were some draft outcomes that we would be tracking in terms of efficacy of this pilot program. So the first thing we had here was enhancing the recovery time within the community. Recovery time is usually referred to the period of time between treatment. So as you can imagine, for people who have substance use conditions, they may receive treatment, inpatient treatment, multiple times. So the longer the period of time of recovery or abstinence, the more likelihood they are to recover for longer periods of time. Also preventing unnecessary hospitalizations. So if you can prevent the need for hospitalization by early intervention, that's an outcome that we can track. The third would be just to reduce Narcan administration per person. So it would be per person specific and in aggregate. And then if you flip the page over, I've got a few more. We will be tracking the reduction of emergency department use, again, per person, the reduction of frequency of fatal overdose, that would be an aggregate, reducing child removal rates due to opioid-related overdose, that would be an aggregate, providing community-based education, the outcome would be tracking, if possible and if feasible, tracking the amount of information that's retained following education and community outreach events. And then lastly, cultivating a recovery community to reduce psychosocial impacts of opioid epidemic. And that would be something that we would want to find out, how do we adequately measure that?
Thank you.
You're welcome. Thank you for the question.
Commissioner Baugh.
Yeah, and Josh, so this $500,000 is, it would be state monies, not Manatee County monies. And we don't know at this point if it would be a matching type situation, or do we know?
That's my understanding.
Which?
That would be state funded now.
Okay, so we don't have to match at this point. And, you know, I'm assuming, I mean, Centerstone doesn't have any programs like this, or?
In discussing this with Centerstone, what I understand is that they currently have an inpatient residential detox program. They have a peer that works for the hospital. This would be something different. So they currently do not have a program like this.
All right, and so they wouldn't even be involved in this. It would be this other company, correct?
It may or may not be them. I don't know who the company would be yet. This was just a draft.
Oh,
So I haven't spoken with any sort of provider of who that would be. This is just the draft of what the pilot would look like. We'd have to seek out who would be willing to do this service.
okay. And it has to be, it's got to be submitted no later than February 2nd, is that correct? I mean, you're on a tight
Whoa.
time, that's what it says here.
That's our in-house deadline. Our deadline to get it to Tallahassee is the 7th.
Okay, by the 7th, because I know the deadline for regular bills was what, this past Friday?
Well, yeah, and funding requests a little different, but
Yeah.
it's close.
Okay,
And to your remark earlier, Commissioner Baugh, local match always gets extra points when requesting state funding. So that's not part of Joshua's proposal, but it carries extra weight.
so are you asking us to be open to that?
I will defer to the administrator on
Y'all
that.
smiling at each other, what does that mean?
I'm just hearing of this the first time myself, so
That's why there's,
I believe if we think that it is going to enhance the proposal, we'll come back and talk to the board. It may or may not be necessary. I just don't think we know enough at this point in time. If there was a match, how much would it be? And there's a world of difference between $5 and $500,000, and I don't know where we'd go. So it's just an unknown.
Okay, all right, great, thank you.
I-
Sorry, but my board is in a time warp. because it says Commissioner Bustle, so I don't know who that is, but
That's
I do
me.
have a question.
Also, right there.
Y'all are similar.
So the,
Consider that a compliment.
It is a
okay.
compliment.
I'm going to talk now. The question that I have is whether or not we have a legislator who has been briefed on this. Have we, we had our pancakes politics, and things are moving very fast this year. So do we
Commissioners,
have?
we thought it important to tell you first, or ask you first, whether, if this is going to be part of your state platform, obviously it needs to have your approval. We were just in the initial stages of discussion when I brought to you your legislative program, which was only a few weeks before the delegation meeting. Our timelines are way bumped up this year, and so that's why this came together very quickly and out of the traditional cycle to normally go on your platform.
Okay.
So no, we have not spoken with anybody. But, again, considering Representative Boyd's ownership of this issue, I believe, told you yesterday, he's sponsoring the opioid bill in Tallahassee, and it's my feeling that, our legislators understand that we're ground zero for this problem, and I think that they would try to be helpful in any way they can if funding could be obtained, especially for a quality pilot program. If we can illustrate that that's successful in very measurable ways, as Joshua's shown it has in other communities, then I think we would have a strong case to make before our legislators. And this is the same guidance that Kerry Roth gave us as well.
Okay. Carol? Commissioner Bustle-Whitmore?
Professional integrity, I don't have any problems with that. And I had written down, we are the epicenter. I don't think we'll have any problems with this. When I was out sick, Senator Galvano and I talked via phone. We were supposed to meet, but I was too sick. And he is interested in these types of issues, definitely. And he's one that brought up that they're thinking, to me about the block grants replacing the Medicaid, so there might be other options too. I understand the matching part would probably give a lot of us heartburn, but I think if we can demonstrate outcomes, and that's what he was even saying. I talked to Dr. Gonzalez yesterday, Representative Gonzalez. He talked to me a little bit about the opioid situation because he was at that meeting with Vanessa and I when we went to the hospitals. But I think if we show something that's worked, that's demonstrated that it's worked in the past, and that since we are the epicenter, we are willing to step up to the plate to show that we can possibly help this terrible situation, that they would be open to it. And I think we could sell it like that, truthfully.
I think, Charles, were you on the board? You might have been. Like I said, it came up Commissioner Whitmore, and then Commissioner Whitmore was
Oh,
Commissioner
Whitmore.
Bustle.
I'm not
I think you're
Whitmore.
Commissioner
and cream.
Whitmore, Smith.
Yes, Madam Chair, I was on the board.
Yeah.
I had a question to Mr. Barnett. This is $500,000,
Yes, sir.
correct? And we applied for this here, it's coming back to Manatee County if we win it. And then you're going to decide what to do with it then. Okay, you're not specifically saying it's going to a certain organization. Okay, great. So we have a strategy if we receive that. And the reason I'm saying that, I think it's good that if we receive the funds, that we decide what the criteria is going to be, how you're going to administer it in the community. So we don't keep doing the same thing over and over again. What I'm being told is that we got something that's wrong in Manatee County for its treatment. I'm being asked the questions, these programs that we fund, do they have anyone that is hired that actually was addicted themselves and overcame it, needs to be the one more in dialogue with someone who's addicted to these drugs to deal with these drugs. But most of them have not been addicted to them. They have their resume, they have the credentials, but they don't know. You can't teach personal experience. So across the state, people are hiring people who've been addicted to drugs, crack cocaine, opioid, and they're bringing them in to work with them to tell them that you can get off. This is the process that I went through. This is what happened to me. Now, I don't know of any organization that we fund that have that on that level, is actually speaking, talking about what they lost, how they may have went to jail, how they lost their family, and this is how I got off. This is what people are telling me those are the ones that need to be kind of leading this charge under the umbrella of someone, but that's what the person addicted to these want to hear, not someone who's never faced this and have different words and big language to use. And those are the things that I'm hearing. In fact, I've talked to some people who are doing wonderful things now. Some of them are legislators, by the way. And you know one that I know that was addicted, but I'm hearing this when I go to different meetings across the state. Who do you have that can talk to these individuals that are addicted, continue to do what they're doing? They need to see some real people who've been through it, who overcame it, who back on their feet and doing positive things. Until you get that, it's just words to most of them. And so I think, I'm glad you're going to come up with some type of criteria. Then another thing, are you getting to the community or they have to come to you? I'm hearing that over and over again. Do they got to run to a social program or are you going to the community to get these people?
I appreciate that question, and that's part of the priority here. What I've heard is there seems to be a lingering idea that there needs to be something built so that they seek out the care, and that is not in line with the current evidence. That's not in line with the current standard of care. It is community-based outreach. It is proactively going into the communities to inform folks with people who have the message of understanding and they are of the community with a similar story. That is where you demonstrate the understanding and the partnership. And just like you clearly said, it's very different for someone who, you can't learn the experience. You can get the credential, you can have an idea of what that looks like, you can understand the theory, you can understand the practice of treatment, but unless you supplement that with people who understand what this is, there is a great dissonance and a missed opportunity to treat more people more effectively. So I appreciate the question.
Yeah, and I've had this to me about maybe 15 or 20 different people told me that. And then when I heard it on 1150, when I was telling you that Ray Charles' daughter who did federal time, and she said she was so addicted, she knew the program better than they did. Well, nothing they can say to her to get off it. And she under the spirits, but she going around getting people because of her life story. You know, and so you need they know what they went through, they know what they lost, and we're missing something like that. It's already the fun stuff, but you got to have that guy. I'm talking about somebody paid. I ain't talking about no volunteering, you handing out brochures. I'm talking about someone who's paid on staff and can get in these churches, can get in these communities. I seen the sheriff department came right off the 2nd Avenue East, and one white female, they picked up 3 times in one day. If she would have seen somebody who was just like her, would have showed up, it would have probably changed something. But they'll tell you, you know that. Well, you don't know what I'm going through. You got to bring someone who's been through it, you know. And I think that's why I'm glad we're getting the money to set a program where we can do outreach. And there may be some need to be run, not just handing money over to organizations, because it's just not working. You'll be amazed that when I go to these places, the first thing come up is Manatee County. And I probably hear it Saturday when we go to the marijuana summit in Orlando, Osceola County. We're number one when they go to talking about it. And everyone, for as legislators to you as senators, have asked me, what are we doing wrong in Manatee County? Thank you, Madam Chair.
Right. Yeah, I appreciate that, and I was going to say, you know, I've had the opportunity to listen to folks tell their stories. I'm thinking specifically at Kiwanis. There was a young lady, and I know she was featured in the paper as well, and it was very moving to hear what she did and what got her to change finally, and what it took. But I've also had the opportunity to meet at Centerstone with a group of people that they're there because their child has passed away. They're there because their child is in jail. And that was very moving because they were emailing me and emailing us saying they weren't getting any response. They were very concerned about how the treatment was being done, and I thought, well, this is nothing that I know anything about, so I'm going to set up a meeting and set it up with Melissa at Centerstone. It was very good for me to understand their stories, and I think they appreciated sharing. So obviously, that is a resource, you know, as we were talking about, how do you reach out to these folks? Well, these kind of support groups that they have, that to me seems like perhaps, and, you know, I know you're the expert on this, but we're talking about, you know, and Charles was talking, do they have to come to you, or do you go after them? Well, I think we have to reach out
Yeah.
to support groups and say, look, this is a, you know, assuming we can get the funding, and we can do whatever we can to help you. We'll be going to Tallahassee, talking with our legislators, we have meetings set up with them, so it's important, and I think Nick knows this, to get us the information. But those are the kind of things I think if we can get a program that you can reach out to people. Does that make sense? Okay. Commissioner Baugh.
Yeah, in talking about support groups, I mean, we have support groups, but they come to the support group. And what you're talking is totally opposite. In saying that, have you had any conversation with our new sheriff about? Yeah, I've heard. You want to elaborate on that, or do you want to?
If you don't mind, that's, I've had the privilege of participating on the Addiction Crisis Task Force. I've been selected, or I began to participate on the Data and Research Subcommittee, which, as some of you know, is a bit of my background, including death and grief counseling and psychiatric epidemiology. So I thought my skills were best placed there, and in one of the breakout sessions, I purposely placed myself with law enforcement to better understand their idea. And what came out of that was a work group that we just completed last week on developing a consensus statement, which I'm pleased to provide to you at the opioid work session. And that's just to get a better understanding and a collaborative approach for how do researchers, how do treatment professionals, how do substance use professionals, how do law enforcement all see this issue, and how do they see their role in the solutions to addressing this issue? So, Mr. Shear, Captain Shear, he and I have had many conversations, and it's been very beneficial.
Yeah, I would suspect that the sheriff's department would be very involved in what you're talking about here. And in order to keep this sustainable, I'm reading here that the county or the group would be reimbursed by Medicaid. Does that help me with that?
So when I've created these programs in the past, you want to have a sustainability component. You are talking about lives and deep connections. So the idea would be if we are to pilot this program, a responsibility of the person or group selected to run this would need to proactively search for sustainable funding. So programs like this can be reimbursed through Medicaid if that's something that Florida would allow, or through block grant funding. When I've written these programs for agencies in the past, I'm one of the cited references in the Delaware's Medicaid-funded peer support program and their supervisor certification program. My work is cited there, so I would make sure that they utilize that information and get funding. And if Medicaid is a funding entity for this, which it is in other states, then that would be an option. But it's just to sort of yield to this program should look for a sustainable funding mechanism, not just rely on a pilot demonstration funding.
And how long do you see the pilot program, how long do you see it being used as a pilot program? A year? What is your thoughts on that?
I think with the measures I've identified, we could see some outcomes rather quickly. So as soon as I can demonstrate to either you or to the state that this is working and it's a solution within a multifactorial problem, I'm hoping that the state would either continue to fund it, or I'm just not quite sure the funding methodologies locally here, as I'm still learning the system, but it would be to find some way to continually fund it and not be a pilot, but be a program that continues to exist.
Yeah, you might want to mention it to Congressman Buchanan as well. I could see perhaps some federal funds on a pilot program as well.
Thank you.
Thank you.
Thank you.
Commissioner DeSabatino.
Great, thanks for all that information, and fellow Delawarean, right? there's a lot, I just saw some articles in this weekend about some churches having forums and panels. I saw that. Commissioner Benak and I went to that fundraiser for Valerie Gilroy's group, which is called,
Trinity Without Borders.
right. So she's has a successful program over there. So there's many partners that I know would love to come to the table. When someone gets administered the Narcan, maybe they would be given information of where they would need to get in touch with a contact person. So that way they would have the information up front, because they wouldn't know where to go. I'm really concerned when, and I'm glad you're meeting with the sheriff, because when people come out of incarceration, they don't know what resources to get. So if that information can be available at the jail before they're released, or when they're there, maybe they can get even hooked up to the groups while they're there. I don't know what kind of programs they have ongoing at the jail, and that would be beneficial to learn. So again, a collaborative effort of, everyone putting their heads together, because as we all say, it's such a devastating situation right now. And, when we had the pill mills, that was something that we could regulate and we were successful. And now this has taken on a whole new life, and it's cheaper and it's easier to get and so forth. So really appreciate all your work on it and moving forward, and your great expertise at such a young age. So it's nice to see millennials here helping us out.
Thank you.
Commissioner Smith.
Yeah, just following up on Madam Chair, I mean, that's what it's going to take, I know quite a few public officials who I've met that was addicted to drugs for many years. And one of them is State Representative Darrell Rousseau, and he's Senator Rousseau. What got him where he's at today, he used to go and get these people out of the drug house, and his story got them treatment because they trusted him, because he understood their language. That's what we got to do. When Darrell came, he wasn't no state representative, because he went and got so many people that was addicted to drugs that the community trusted him, because he was getting their sons, their nieces, their nephew, and they trusted him when he said, well, I was on drugs, and they were stunned to find out that he was on drugs and what he went through. So it's a trust factor there. The sheriff will have to come in later. They're not going to trust the sheriff with this, because they got to have a confidential conversation. And Senator Rousseau will tell you, he know their language. When they go to see, say, well, I didn't have a license either. You didn't? They can relate to that. But if you got someone there who just got a resume, ain't never been in trouble, ain't never been addicted, wearing a $200 suit, it's not going to happen. And we need to do more outreach. So I'm really glad you're doing this. And some more other public officials, I'm not going to call their names, but I just use Senator Rousseau, but who was addicted. But boy, they can go and get these guys, two ladies, out of the house. And when they hear, they trust them. They know how it was at night, sleeping on the floor, no food, no driver license, no job. And you got someone that hits that level as a senator.
And they have children.
And they have children themselves. I mean, Darrell probably, he go across globally now and speak. Thousands of people, just because he went and talked to them and got them out of these houses, been rehabilitated because they trusted him. They didn't give up. They felt like they can get back where they were, like he did. So he's already an attorney, But he'll tell you, but that's what it's going to take, outreach. These churches, these churches, all these people, we wait for them to come to us. No. Thank you, Madam Chair.
Okay, well, sounds like you got a thumbs up. Go for it. Tell us what we can do to help. At this time, I'm going to open up real quick for public comment, because I have a feeling our next item, they're very different, so I doubt the crowd's the same. So in order to allow people to speak on this item, and come forward, please.
Thank you very much.
Thank you.
Thank you. Good job.
Go home and sleep.
Sharon Kramer, Director of Drug-Free Humanity. I'd like to make a comment to Commissioner DeSabatino, because you mentioned when somebody overdoses and they get Narcan. I'm really excited to tell you that I heard last week that a product that we put out called Your Life Matters, it's a card. On one side it says Your Life Matters, on the other side it has all the resources, has become a best practice in the state of Florida. And it's something that we created using the gift, the talent from Mike Dunn, who is local law enforcement, I think Cedar Hammock. He designed it, and we produced like 75,000 of those cards. We just took like 6,500, a box of 6,500 to every library. But it's a best practice in the state of Florida, so I just wanted you to know that. I just wanted to comment because the Addiction Crisis Task Force was formed in 2015, at the beginning of this crisis. We brought together like 25, 30 people every month from across the county, EMS, hospital, law enforcement, educators, both the public schools and the higher education. All the people that really have a part in what's happening, county government participated. And we used a CDC model that looked at many strategies that need to be addressed. It's not a simple problem, it's a very complex problem. So we looked at prevention, education, and harm reduction, and access to treatment, public policy, and brainstormed and brought out from the community sectors all these strategies that could impact the problem in Manatee County. I'm actually putting together a document for your meeting on the 14th so you understand what this Addiction Crisis Task Force has already accomplished. But one of the things we did in that process of identifying strategies, in December, we separated into committees. We had a healthcare and treatment committee, a law enforcement and judiciary committee, and education committee. Out of the healthcare and treatment committee they looked at the actionable items that we had identified. The number one actionable item that was uniformly agreed upon by all of these people talking for such a long time was the peer coach, the peer specialist, the peer person that that Josh was just presenting. So he has been participating in that committee recently. The other thing I would acknowledge, and Josh is a part of it, he mentioned that he's on the Data and Research Committee that has been set up as part of the Addiction Crisis Task Force Committee. Drug-Free Manatee was selected by the state of Florida to receive some funds with a grant called Partnership for Success. And this year, this is the first year of that grant, the first order of business was to gather data. And we have been asked to set up a DENS, which stands for Drug Epidemiology Network. We have Jim Hall, who is a state epidemiologist, coming in March. Josh will be meeting with him, as well as the whole team, the data research team, to look at gathering the data that Commissioner Whitmore was interested in. We want to gather the data so we can look at the outcomes with any strategy. Oh, 3 minutes. So just wanted to acknowledge, bottom line is that all of these people talking for, the time that we've been talking, that was the number one strategy that came out of the healthcare committee.
Right, good stuff to put in a grant application. Catherine, please.
Catherine Edwards, thank you very much. In listening to Joshua talk, I was just astounded that there are so many programs that already exist that do exactly what Joshua is proposing. And in his list of groups that he was consulting with, law enforcement, researchers, treatment specialists, not one of those groups, not one of the groups mentioned really, was any of the groups that are already performing many of the functions that he's proposing. In particular, one such group, Alcoholics Anonymous, could as easily be called Addictions Anonymous. Mm-hmm. And as a child of an alcoholic and an enabler, I understand how helpful these programs can be, not just for the one who's addicted, but for the people who are impacted by the addiction. When you look at groups like Centerstone, and I'm sure they'll be in the mix when he's looking for agencies to help him out. They have a psychiatric approach only, And a psychiatric approach is certainly important to have, particularly with respect to addictions like heroin, where a prescription may be required to help get them off it and keep them off it. But that's only a third, maybe a half the battle at most. And the other half of the battle is psychiatric counseling, or excuse me, psychotherapy counseling. It takes a lot longer. It's not something that can be done in 10 minutes with just writing off a prescription. And the current imbalance of psychiatrist to psychotherapist at Centerstone reflects that Centerstone's focus in particular is designed to maximize the number of people that they can treat, to maximize the amount of income that they can have, which is probably part of the problem that the county is having with an opioid addiction. So I urge Joshua in his efforts to please consult with treatment specialists who don't have a psychiatric bent, but a psychotherapeutic bent as well. And furthermore, other issues that really weren't looked at was the criminalization of addiction. And I think whatever program he's proposing needs to have this as part of its focus, because tons of money can be spent on trying to figure out ways to monitor progress when no progress is ever made. Thank you very much.
Thank you. All right, anyone else to address the board on this issue? All right, we're going to go ahead and go forward with our next discussion.
I would like to comment on that, Madam Chair.
Commissioner Smith. I want to get set up for your transportation project status, but go ahead, Commissioner.
Thank you. I agree with everything that was said, you know, and but here's what the problem is. I agree with everything, but we have to redefine these organizations out there. I have yet, unless I'm wrong, and they can correct me because I talked about it in the Public Safety Coordinating Council, I have yet to meet anyone that's doing outreach in the community that has been through what most people are going through, that's rehabilitated. They can go out there and talk and tell them, I've been through this, and can be the face of a 20-year recovery person that can talk from that standpoint. I have yet to meet anyone from these organizations that has someone can testimony to the fact that for 20 years I was addicted. I lost everything. I was on the streets. We're looking at people, that person should be working with one of these organizations, not about a resume and you been to jail, we can't hire you. Those are the people that are going to bring people to these facilities and get help for them, not just sitting there showing up to these meetings, because the only thing we can do at the end of the day is allocate money at the end of the day. But it's not working. And I've been asking, who's your outreach person that's in the community, the person who's been in trouble with the law, maybe was homeless, now they're back on their feet, that these people can trust to bring these people to the facilities. And the lack of housing is big with what we're dealing with for is addiction also. It's really big, and it's middle class folks, it crossed through barriers, religion, you name it. I'm seeing some people now that I know that are attorneys, but I know they're in my community. I followed two of them going to a location. I know they're selling this stuff. I was stunned. I was absolutely stunned.
Commissioner Ball?
Yeah, just real quick. I just wanted to say, Catherine, that was an emotional conversation that you had with us, and I appreciate it, and I think that you're probably really right on the money. I just wanted you to know that. Thank you.
Okay, thank you. Ron?
Good afternoon, Board. Ron Schulhofer, Public Works. About 6 weeks ago, I think the board asked during a board meeting to come back to you and give you an update on the major projects that we got going on in transportation. And it was geared more toward our two new commissioners, but it's good for everybody to hear where we're going now with the updates. So Sia's going to kick this off. He's got some of his team members here. We also have FDOT, who's going to give you a little brief on the diversion diamond, where we're at with that one. And I think there's a couple of citizens that want to speak after this. I'm pretty positive they are. So I'm going to pass out what he's going to show you, so you can make your notes on these if you wish, and take them around the community. See you. Thank you.
We can pass them down if you want us to. Want us to? Pass them down?
This one is the next to last agenda item. I think you guys just be aware of what's happening with 19th Street. You're gonna get a lot of questions about that one down the road.
For the warning.
That's the next to last item.
Thank you.
Thank you.
Thank you, Ron.
Good afternoon, CM Milanoza with Public Works, Deputy Director, Engineering Services. It was May of 2013, last we discussed the 44th Avenue project from one end to the other. There were three segments. One segment from the mall to 19th Street is complete, and it's been open for a year. We're going to pick up from the second segment, which is 19th Street, from 19th Street to 30th. This, as you know, 44 is a four-lane thoroughfare, bike lane, sidewalk on both sides, medians. In this particular segment, we have a signalized section at 19 and US 301 and 30th. This was what was presented back in 2013. The east, on the left side of this screen is 19th Street, the beginning of the job, and it would end on the right side of the screen, which is 30th, going through the open field, which you all have seen driving down 301. As part of that project, we had two also roundabout, one at 38th and 30th, and one at 38 and 27. In this configuration, it would result a writing right out at 38. The signal will go away from 38 and move to the new 44. This is the 3827 roundabout, and again, at this location, this is writing right out on 301 only. What was presented back then, this was the configuration of the laneage on US 301 at the signal, and this was the typical section for the roadway that was being proposed to be built back in 2013. Again, two 12-foot lanes, bike lane, 4-foot bike lane, 5-foot sidewalk on each side. During that particular year, the board directed to change the laneage to 11 feet, so we are going to stripe it as 11-foot lane, which basically makes the bike lane wider. This is the project under construction as we speak. It started last January. The far in the background of the black top you could see, that's the 19th Street way out there, and where the houses are toward the front of the picture is 30th. We have a little clip on this one. It's about 90 seconds. We had a drone flying it. The contractor, A.T. McKenzie, starts at 30th. This section, by the way, is right now paved. This drone was done about 10 days ago. It's reaching to 301. That's where the new signal is going to be, and you could see the mast arms. They're all in. Now this is the open field on the west side of 301. The roadway, and you got the pasture on both sides, and the stormwater management system, the lakes all on the left side of the screen, and it goes on all the way to 19th Street. 19th Street on the right side, you got Team Edition, and then you have the new signal at 19 also. Again, this is about 10 days old drone. I think this particular piece, it keeps on going westerly. This is the section that's been open over a year now, all the way to 15th Street, and then we stopped at 15th Street for this particular video. You've seen from 15th Street all the way to the mall. It takes a lot of traffic, as you could see even on this video. There's a lot of folks using the roadway.
It's awesome.
Good job.
We anticipate completion in 2017, a little bit delayed. We had made some changes to the project. A lot of it on 30th, we had turn lanes at the intersection, and the driveway at the church on 30th is going to be rearranged. The driveway at the church on 19 and 40, at 30th and 44 is way too close to the intersection. So all of that will be done fall of this year. Total construction cost, the contract with McKinsey is $11.9. The 30th to 45th segment, again, same segment, 4-lane boulevard section, bike lanes, signal at 37. The signal at 37, staff added that in 2013 when you all saw this project. The signal wasn't there. The traffic engineering performed some analysis. We're going to add some turn lanes. That's the new addition we did to the job. And the signal was designed in-house. The structural was designed in-house. It's a string signal, but that's the add-on. Again, that project started at 30th on the left side of the screen. That was what was presented in 2013. On the north was Highland and Wallingford on the south side, and Oak Trace. This is the Sellers Pit where we had a little causeway going through the entire lake system on the left side of the screen. And then on the right side, that's Fairfax, and the project would have ended at 45th, where Fairfax and 44 would meet. This was the typical section for the causeway that was proposed in 13. Same typical section would carry throughout the whole roadway, 5-foot sidewalk on both sides. And again, we're going to stripe it 11-foot lanes, even though they're built 12-foot. So the church is on the left side where the pavement ends on this particular video, and then Highland is on the right side. This shows the roadway. I call it the causeway going across the Sellers Pit, and so on the left side in this stretch you got Fairfax. And the end of the project is where you see those red line in the dirt. That's 45th. We had to rearrange this roadway at this intersection also, since you had seen it back in 2013, and predominantly the reason was if we could finish what we proposed over here, 45th Street project that is in purchasing, being advertised for bidding, would have come tear it up and redo it. So we took a portion of one project and put it on the other project, so we do it one time and finish one time. Just some ground shots again. This is looking westerly at 30th. This is the Highland is on the right side, and Wallingford is on the left side in this picture. Now you're on the right side, you got Oak Trace, and the left side again, Wallingford. And on the left side on this picture is Fairfax. Once again, we got a 90-second drone shots on this one. Again, we're starting, this Woodruff & Son is the contractor. We're starting at 45th, heading westerly. Fairfax is on the left side. The linear pond you see on the left side, it belongs to Fairfax. It's not done part of this project. It was rather cleaned up. The lights are in. The sidewalks, the road is pretty much complete, with the exception of, again, 37. We're trying to do the turn lane and the signal. The stormwater management system is on the right side of the picture, and we're coming to the causeway going across the Seller's Pit. This is 39. This is 39 there, yeah. And this is 37. The 37 is not finished because of rearrangement, adding turn lanes and the signals. We have wetlands on both sides in this stretch. Then you reach on the left side of the screen, you see Wallingford along with the power line easement, and on the right side is Oak Trace, and now it's Highland. I thought it came out real nice, the roadway. We're all pleased.
It's awesome.
Again, we anticipate summer of this year to finish the job. Woodruff and Son was the contractor, the original contract, $10,400,000. The next segment we talked about back in 2013 was picking up from 45th Street going across Braden River. ERP, or Environmental Resource Permit, has been submitted. We are waiting for their first request for information official from the regulatory. The permit has been submitted. That's a joint application that goes to SWIFMA and U.S. Army Corps. As you all know, there is some eagle nest in this area. One of them was at the what's known as King Ranch, and that's at Morgan Johnson. The Coast Guard letter, you already know, we have that approval from a couple years back. And AECOM, which is the old URS, AECOM bought URS, is the engineer on the job. The 100% plan is in our hand. We're basically starting the land acquisition. There's a lot of land acquisition issues on this particular project. The water main was added to the project going across the river in accordance to the utility master plan. This shows bird's eye view of the roadway. On the left side is the 45th. We're going across the river, Morgan Johnson intersection, Caruso Road, and then ends on the right side of the page, which is what's called 44 Plaza. The next slides, I'll blow them up a little bit so you can see a little bit better. This is, again, the same configuration as before, with the exception of we added a 10-foot from here on, the 10-foot trail or sidewalk on one side, 5-foot on the other side. Wow. Okay, here is the 45th connection at this intersection. This 45th at 44 will be signalized, which is part of the other job, previous job that I just showed you. We're gonna go straight through, and then we swing a little bit to the south. As you know, the power line, FPNL power line, they've been out there for the last, 20, 25 years or so. We're gonna go under the power line in this stretch. We swing south. We go then on the south side of the power line, we go parallel to the power line across. So this is where we swung south, and now we go straight through following the power line. So the power line will be on the north side of the roadway. And the main reason for that, we did the analysis of the alignment, including the roundabout, by the way, and this was the best alignment. This alignment, if you had gone straight, you would wipe out all the houses on the right side of this photo, as you could see. This, and this is the stretch of the river where we cross. You see the power line, so the roadway will be on the south side of this power line. Morgan Johnson will be extended a little bit south into the field, and that's where the intersection will be. And then the 44 will continue and will swing a little bit north to its original existing alignment where it's at right now. And that's the reverse curve that becomes the Caruso at 70. This shows the roadway and intersection will be just south of this power line or the tree where the power line is. That's where the new intersection will end up. This is Morgan Johnson right now. And this is the Caruso and the church in the corner. So once we pass Caruso, we go straight line to 44 Plaza. We follow the old 44 roadway. And that's the end of this particular project. And this is the stretch just east of Caruso. As you can see, the power line, so the roadway predominantly will be where the existing roadway is and north. So the new two-lane, the additional new two-lane is to the north side of the existing two-lane. The construction cost estimate for the roadway, we're at 44 million. Utility water main construction is at 18 million. That was a new one because of the utility master plan that you have in place, and we're trying to follow the master plan. By the way, it's not this estimate does not include land acquisition, and we're beginning on that land acquisition now. So the next segment we talked about in 2013 was where we pick up this last project, which was 44 Plaza and 44, and we hit easterly and go across I-75. We have a 30% design plan right now. They're in coordination with all the regulatories. In this stretch, also there is a bald eagle, and they are doing a combined with the first project, we're doing one application for two. So far, a third one I've heard has showed up too. This is the alignment. This is the new alignment. The big difference in this particular alignment is what you saw in 2013. The roadway cut through, straight through that effluent pond in the middle of the picture. This one, we're gonna swing south and basically go around it and connect to the Lakewood Ranch Boulevard on the right side of the photo. Once again, we're gonna blow it up a little bit so you can see better. The roadway does not change. It's the same 4-lane boulevard, bike lanes and sidewalks, and once again, the 10-foot sidewalk on one side and 5-foot on the other side is in place in this one too. So this is now a 44 Plaza. We pick up from the old project, and this is the stretch on this curve is the old Creekwood. And it comes to a T intersection on the right side of the photo. That's a Creekwood Boulevard that connects to 70. And in this stretch, basically, this is where the existing Creekwood Boulevard is. Half the roadway is already in, so the grassy area becomes a second two-lane. Once we pass the T intersection, this is the stretch that we start beginning the bridge ramping and going across I-75. This particular area, this is where Creekwood, same spot where the T intersection is. In this area right now, Neal community is what's known as the Ridge. We have worked with Neal's community. They're building this intersection, the T intersection, and the road short of the bridge approaches. And it's this is the ridge on the left side of the picture. The home's gonna be built. Well, the homes are already built, some of them. Right there, you could see the homes. The wooded area basically is your new 44, and that's the stretch Mr. Neal is supposed to build. It's part of the original DRI. that requires Mr. Neal to build and subject to impact fee credit. And we're working on that, and he's got his 100% plan. We just have, he has to bid it and start the construction. And the idea, again, once again, was have this roadway in and don't end up another Fort Hammer and Waterleaf scenario. So once we cross I-75, this is where we swing south to miss the effluent lake on the, we swing on the south side of it. And again, this is just a recent photo of the same effluent lake. We'll be on the left side of, hugging the lake on the left side of this photo. And we land in existing 44 in Lakewood Ranch on the right side of this photo. And this is our destination. 44, existing 44 in Lakewood Ranch.
Who planned this
Melbourne.
30 years ago?
We're at 2 million design costs. We have some estimate on this one. Land acquisition is not as hefty as the very first one, so we had some numbers for that, 1.4. Road construction is estimated around 25 million, and the total combined with engineering and construction, 29, and we're anticipating having 30% plan completed this year. With that, we'll jump on to 45th Street East, which is basically from 70 to 44. This project is 100% complete from the design standpoint. It's in purchasing, should be advertised any day right now. They've been working on it for a while. And I think it shows up in the newspaper any day, any week. It was about 1.1 miles. It's same roadway as the 44 that you've seen, 4-lane boulevard section, bike lanes and sidewalk on both sides. The big canal on the along Peridia gets box covered, so it gets covered. Folks like that. And we will have a signal at 45th. Again, this on the left side of the picture is the State Road 70, and we're heading north towards Sable Harbor. You got Peridia on the top of the picture and Sable Harbor on the south side. And the end of the project is at 44 on the right side of the photo. Once again, this is the typical section, no different than the rest of the thoroughfares that we've been building. The big canal system gets culverted, and the fence line on the left side of the photo is shown is existing Peridia fence. Like as I said, it should come out any day for advertised bidding. We're construction cost estimate is $12.5 million. We're going to now 53rd Avenue from 43rd Street West to roundabout at 75th. This we'll have sidewalk on one side. It's 4-lane boulevard section. I have to give you a little background on this. If you all recall, those of you who were around maybe 15, 20 years ago, this road was designed once. It had a 14-acre lake for stormwater management system. Due to economy or whatever, it went on a shelf. It never got built. Right around 2009, 10, the board wanted to see if it could build this and take advantage of the economy and the low prices in the constructions and what have you. And we took that job and in-house redesigned the roadway, eliminated the entire 11 acres of land that was needed for stormwater management system, and created a linear stormwater system. working with Lake Flores, knowing if we build this linear system, Lake Flores, once they come in, they're gonna rip it all out and make it a curb and gutter. So it doesn't have a curb and gutter other than the medians. As part of this project, obviously, the 42-inch force main, and there was a lot of plumbing, redo the plumbing on that stretch because that's where the plant is. So the project, again, started at the 75th Street roundabout and heading easterly to 43rd. 4-lane divided section, full 12-foot laneage, 28 feet medians, all the turn lanes at the intersections, and this is Glen Lakes, and then we end at 43rd. This was the typical section with the lighting in the middle. The lighting in the middle right now is not part of this particular construction contract. It's in purchasing for a separate contract to be lit. Not much to report other than the progress. The ongoing progress is that most of the utility work at last is done. We're talking about 42-inch force main in the center of the road, and there were you got pipeline coming in from Longboat Key toward the middle, which serves the entire Longboat Key. Very tedious, making sure you don't have any accident or damage, and so most of the utility work is done. And the utility work was not a small task neither. We're talking about $3-4 million worth of utility. Anyway, the photo is you're looking at 75th, and then on the right side of the photo, we're talking about looking at the effluent lake at 66. The project, the road portion of it, as you can see, is $5.3 million, and utility exceeded the road, 6.3. Total cost $12 million, and we're going to finish it off this year. Good. This is a Tallahassee Road Sidewalk project. We just completed this right before Christmas. There were a little bit loose ends. We did it after the Christmas, but basically it started as a simple sidewalk project. Before you know it, it just got larger and larger. The roadway was narrow before the railroad track. We had community meeting with the neighborhood to find out what their needs are and what have you. Found out they need to have a community center south of Tallahassee, that their kids walk from the community center to Tallahassee to get to their home. So we added some more sidewalk and pedestrian crossings and so forth. Again, the project started on the left side of the picture. We're starting on the right. US 301. That's you all had a tour not long ago at the transit station where the transit facility is. So we're in this stretch. We widened the road by 2 feet because we only had a 20-foot roadway. We come to the railroad track, and we finished it at 15th Street on the left side of the picture. The little black line that you see in the middle, which is 17, that's the sidewalk we installed south on 17 from the community center coming to Tallahassee, and installed a ped crossing with the flashers. This photo was taken right before the sidewalk was installed. It's already in the ground, shown at 301 looking westerly. This is the transit facility location, Tallahassee, and the sidewalks. And this is the new stretch that got new pavement and new road widening, and you could see the sidewalk within it, and that's what it came out. It looked pretty nice, and we're very pleased with it. And the roadway widening continued to the road on the top of the picture, and that's why you see black asphalt versus the asphalt to the west of the railroad, which is the old asphalt. And the sidewalk continues, and that's the Lockheed Martin facility. This is where the ped crossing with the signs are. And that's 15th Street on the background. The total cost for all, which was again sidewalk, a lot of piping, a lot of drainage piping. There were some water services redone, railroad crossing was in there, $1.4 million. Going to Fort Hammer, for Upper Manatee River Road, Fort Hammer Road, and Fort Hammer Bridge. You're all familiar. It's a two-lane road with sidewalk. It's got turn lane, roadway's got turn lane, traffic signals. Upper Manatee from State Road 64 to the bridge, then the bridge, and then from the bridge landing at the Fort Hammer Park all the way to 301, short of 301 to the north. We have a little bit of a 3-minute clip here. Again, the drone starts at 64 on the south side. We're heading north. We're going to come on the right side. The first one is the 10th Avenue East, and then after that, 8th and Greenfield Boulevard on the left right there. And on the right, there was a new subdivision. It's called Copperleaf coming in. This is the left is the end of the Greenfield, and on the left on this side is the new Port Harbor Park.
They were running.
Run, Forrest, run.
Someone open a bag of potato chips on the other side.
Oh, that was the humor of the day. The cows, they were running after the fresh green tomato truck.
Oh, okay. I thought the drones.
This is the Waterleaf stretch now. As you can see, the detour is still in place. Again, this is about 10 days old, this shot. We're coming to the new intersection of the Upper Manatee and Fort Hammer, and that's the back entrance of the Waterleaf. This clip just concentrates a little bit on the bridge.
You're getting there.
We put it on fast mode. We didn't want to take you, I have the slow motion or regular motion if y'all interested to look at it. It's,
Cool.
for the sake of time, we put it on fast. Go ahead.
And the other two lanes are totally separate?
Yes, and if the board wishes, one by one, I can arrange to take you out to the bridge and you can go out to the end and see what it looks like today. If you're interested in that, I'll have Michelle contact you and set them up. Is that a?
Yeah.
That's a yes.
Yeah, we will do that.
Yes,
Y'all
I'm
want-
very interested in the intersection on Upper Manatee Road.
Yeah.
Yeah, now we're on Upper Manatee River Road.
Somebody's
Not the
speeding.
next.
The left side is the old River Wilderness. I think this was Mulholland, unless I missed it. Mulholland and Golf Course Roads gets a signal, by the way. This is
right there.
Chelsea Oaks, I believe it's called. We're coming to the school on the right side. Continue sidewalk. We did a lot of turn lane for the school to help out with the traffic for dropping off and picking up the kids. This is the Old Tampa Road intersection. The roadway continues north with the sidewalk on one side, on the left side of the screen. And we installed turn lanes wherever there was intersections and what have you.
Let's go to PJ's Barbecue, right up the street.
Golf course.
This is the golf course intersection.
That's crazy busy. See, I'm thinking that's so-and-so's house, so-and-so's house. Best baker in the world who just passed away.
This is where the end of the project was, and from here on is the old Fort Hammer. We finished a couple years ago the realignment of Fort Hammer at 301.
Uh-oh, stop. Wow. I don't want to see the rest. Oh, no.
We're anticipate completion of this whole project this year.
Yeah.
As you know, the contract was 23 million and a half for the bridge and roughly 3 for the Upper Manatee and Fort Hammer, about 6.5 million.
Madam Chair,
Yeah. Schulhofer
With-
owes me dinner. He lost by $1 million.
Question on-
will the bridges be dated?
Typically, they will be, I'm sure it will.
Okay, with completion, will it be dated, the bridge? Okay.
Talking about
A plaque?
a plaque or a sign?
Well, I mean,
Yeah, they all have a,
all the bridges have a date.
No, they will
On
be
it?
dated. It's
But
like
they-
a
for
little
history.
plaque, it says.
Yeah,
Okay,
yeah.
okay. That meant-
Okay, Rye Road. Not long ago, we had a work session about Rye Road. We heard you all loud and clear. We revisited the road. Very quietly, we had a little mini crisis regarding sewer enforcement. We took care of that too. The need for the future development and present development, all the folks that had approval now started building, caused a little required upsizing force mains. The roadway itself, it was always functional improvement, which means we were changing it to 12-foot roadway with 6-foot bike lane and sidewalk on one side. The force main, the sewer, they like to be away from the road, not under the road, away from the road. So the decision was made to utilize this right-of-way that we had on Rye Road for the past 25, 30 years, not being used, predominantly along the west side, Mill Creek. So the force main was designed to go in that spot, away from the road, away from the future roadway. It's a 12-inch force main. And we did a partnership with D.R. Horton, who did the force main, and almost complete right now. As part of the force main, again, we made another change about a month ago. We decided force main went in, some of the sidewalk came out, and we didn't want to reinstall the sidewalk in the old spot and then come back with a roadway improvement and tear up the sidewalk. So we brought forward the sidewalk money. The idea was force main goes first. We'll put the sidewalk right on top of the force main, tucked in on the west side, and be done with it. So we have brought forward the funding for the roadway just to do the sidewalk as part of the sewer project. So the transportation is funding the sidewalk portion of it. And you will see an amendment in a near future that allows D.R. Horton's contract gets extended to deal with the sidewalk. The roadway itself, again, starts at State Road 64, the right turn lane. We just installed that not long ago also because of the outcry of people of the right turn. But anyway, the roadway itself, the black line starts at State Road 64 and heading northerly. The purple, what you see out there, is the sidewalk, the new sidewalk, that is. And the light gray along the shaded black of the pavement is the bike lane. We will have 2 pedestrian bridges that will be done as part of a roadway. There were 2 or 3 pedestrian bridges existing. We're going to utilize those. That's one of them you see in this picture where the sidewalk, the purple sidewalk comes back, tucks the road. That's where the existing pedestrian bridge is, in this location, just south of Waterline Road. Heading north past Waterline Road, again, we made sure there are turn lane movements at every intersections. And this is another pedestrian bridge that you can see. We're reutilizing it. Of course, there will be guardrail extended all the way to clear path where the sidewalk is way away from the roadway. So there's a safe passage. And This is the north side. We're going to get to the school. This is the school piece. And then on the north side of the road. And the background photo is an old one. This is where Del Tierra is at the north side. And this project also have a lift station, master lift station, that I think you just executed the land acquisition portion of it from Regan's Ranch about 2 weeks ago. All of that is designed and it's going in place. This is what we did for the force main sake. This is that right away along Mill Creek. Again, as you could see, the roadway and the existing sidewalk. We took the brush and saved most of the trees. We saved them, and on the left side of the picture, that's the clearing where the force main actually went. This is another photo, again, showing the existing sidewalk. This sidewalk, as part of a road project, will go away, and it will be in the middle of the trees, tucked in the middle of the trees. I think it's going to look real nice, personally. This is, I don't know if you could envision this. This is the typical section. So on the left side, where the stake is, where the pipe is shown, that's where the sidewalk goes. And the roadway widening takes place where the roadway is and the existing sidewalk is. This is another example of it. Again, the sidewalk is tucked. And by the way, we're installing 12-foot sidewalk in this stretch, in the whole
Oh, I'm
stretch.
glad we're moving to 12 feet.
Golf carts, yeah, I know, they'll be multi-use. Yeah, multi-use golf carts.
So the roadway, we're at 2.6 million. The 12-foot sidewalk, 434,000. Out of that 434, you're gonna see an agreement coming to you shortly. 65,000 of that sidewalk was existing sidewalk that utility had to replace. That's the one they tore up. So the transportation would fund the remaining 300,000 and change, and we'll have a brand new sidewalk tucked away from the road construction in the future. And I personally think it's going to look really nice. I think it's a Lakewood Ranch type of product.
Had to say that, didn't you, see?
Yeah.
If I may, 1 second, and I think our MPO members know that FDOT has settled on a roundabout, Rye and 64.
Paper.
We don't want to talk about
didn't
that.
talk
Fred
about
from the
that.
newspaper had it on his Twitter account the other day. Looked very nice, Dale. Way to go. But just so the public knows.
Well, that was going to be my question. Obviously, that turn lane goes away, and what do we have to do to design on our side, the Rye Road? I mean, on the south side, it's totally different. So what do we have to do?
It won't affect us. They have our drawing, and our lane is, if you remember on the graphic, we didn't touch the 64 itself. We're just several feet north of it. You're talking about Rye at 64?
Yeah, yeah.
No.
They have the design.
That opportunity to turn so we don't have backup is incorporated into the roundabout.
Okay, so there's enough right-of-way, they have everything they need to put the roundabout in at 64 and Rye.
I don't know that we've seen 100% of the plan, but yes, when we talked to them preliminary, it wasn't going to be an issue. We'll work through it with them if we need to, so.
Okay,
I'm sure these guys have got it, so.
okay.
Saji's gonna speak. 19.
Good afternoon, Sajid Kamia, Public Works, Deputy Director of Traffic Management. Want to talk about a couple projects that SIA isn't working on and isn't working on yet. There's just two quick ones that I want to give an update on. One of them is, some of you probably know, 75 at 301 FDOT has been redesigning that interchange, and basically it's going to take out the partial clover leaf and make it look more like a traditional diamond interchange. And we've reviewed, I think, 30% plans, and so it's still under design. And for the most part, we had no comments on it. It seems like it's going to be a good project. We did just have a concern about one item. This is an aerial, and you can kind of see a little bit here in the yellow boxes. We did a traffic count on 18th Street East, which turns into 19th Street East on the west side, and 18th Street East on the east side of 75. In one day, we found about 1,800, almost 1,900 vehicles on the west side using 19th Street, and about 2,600 vehicles using what turns into 18th Street East on the east side of 75. In looking at the designs and looking at the state's proposed interchange, they are proposing removing that connection. So if you bear with me for just a minute as we kind of go through the color coding here, the blue shows you all existing. This is FDOT's plans that we had, or at least the latest that we had. The blue shows you existing right-of-way, existing used roads. The yellow with the red outline is their proposed cul-de-sacing, rounding off so that you cannot connect. What the blue with the red in the middle, they propose to remove. So our concern is that a lot of people use that, and so we'd like to maintain that just from an operations sense. If people are no longer using 19th or 18th, they're going to be using 301. And, you know, from a network capacity perspective, it's always good to be able to use your local connections as much as possible. And so we would lose that. And then the other concern is, I mean, hopefully it doesn't happen this way, but it seems like every 8 to 10 years we have a major issue on the interstate. And if you recall, the last time that there was a truck fire nearby this location, this 19th Street was used quite a bit for, you know, moving folks around where they couldn't get on to 75. And so we had relayed that concern to FDOT, and they had some issues with funding and having to relook at the PD&E. And so they sent us this letter, and this is what Ron handed out to you earlier. They sent us this letter basically saying that they regret to inform us that they won't be able to honor our request. So at the moment, I just wanted to let you know what the current direction from FDOT was. We have relayed this concern to them, and based off of the reasons that they gave us in a memo that we can share with you if you like, but they cannot move forward with it. So we mostly just wanted to give you an update on that and let you know the status of that. And if there was continued ongoing concern on your behalf, then we can work towards continuing to communicate that with FDOT if that was your desire.
Commissioner Trace.
Two issues on, as far as the 18th and the 19th, as a person that drives through there quite a bit. I often, if I can make that left-hand turn going on the 19th right there, you just do it just to avoid all those traffic lights.
Ma'am.
I mean, so the 2,000 a day are just people that know what they're doing and, you know, trying to make it quicker. What I'm saying is, you know, the same thing, if there's a bad wreck, you're going to make a right somewhere else and get on Mendoza Road. So, I mean, you know what your options are. And I just was wondering if SIA realized that the FDOT screwed up 62 so bad that the truckers are now using Spencer Parish, Rutland Road, and Rye Road. So I'd hate to see us paving that and then having all that trucker traffic that really should not be on those roads.
Yes, ma'am.
I mean,
We've
are
talked to
y'all aware of
FDOT.
that?
Yes, ma'am. We've talked to FDOT about that curb that sticks out on
Yeah, you just
62.
flat out, yeah, a semi flat out can't turn onto it or off to it, so they're taking the back roads. Someone that's going south on 75 from Lakeland will take Spencer Parish, Rutland Road, Rye Road to get on the interstate, which is ridiculous.
We're working it back with FDOT. We've made them aware of our concerns with that.
Okay.
Yes.
I just hate to see us pave it and then have, you know, 50 million 18-wheelers going down that road.
Thank you. Yes, ma'am.
Commissioner Whitmore?
I think that we should, this is to me, a public safety issue versus anything, and this collector road. It is a lot of cars for a little road, but if you'd see all the cars, as we all know, that go on the main drag, it's nothing. But if we could prove to FDOT, if we have documented incidents where we've had to divert traffic, and then include that in our appeal, I would support us appealing that decision up to FDOT. But by demonstrating by facts, you know, accidents, having to divert, the tanker crash, et cetera. And to me, this is not a convenience, this is a public safety issue. I would approach it that way, it is.
We just needed the board to hear that there's a concern. When you hear that many cars going through there, when this gets cut off, they don't call Saji first, they call you normally. So we want to make you aware of that. So if you want us to step forward a little, readdress this with FDOT, we'll be glad to do that.
Yes.
As the board's desire.
Commissioner Ball?
Yeah, I was just going to make the comment that, you know, Saji, you're so good at going around and having quick meetings with all of the commissioners, and I was just going to say perhaps this might be one of those where you need to meet individually and discuss this issue. Because, FDOT is a great partner, and we want to keep that, so.
Yeah.
Yeah, and that was going to kind of be my comment. I don't know the reason that they're saying no. It's not real clear to me. However, I do know that we're in desperate need of improvement going over the bridge, and it is a huge project because of the need to expand that. So rather than digging our heels in at this point, I would like to look at alternatives. Because, as you said, we haven't really seen design plans, so as to, I understand, the easiest thing always to say first is no. I get that. But I want to make sure that we work with them to get this done, because it's very important.
But we made our request based on our data. We have seen the plan. That's the plan I just showed you a second ago.
Yeah, well, much of a plan.
So we need to, we just want to make you aware, and then we'll go back and readdress with them that, this is really something we more than desire. We need it. So, and we'll have the data to prove that. So just want you to be aware of that. And you're right, FDOT's a great partner. We're not trying to be obstinate with them. We're trying to work with them on something we know our community needs.
Well, I just know at some point, sometimes, well, we've run into issues before where they've said no and meant no, and so I want to make sure that we have,
stoplight comes
the
to
discussion going. Yeah. And like I said, this is an important improvement for our community. Commissioner Trace?
I'd be happy to give up 18th and 19th for a new bridge somewhere between Ellington and Palmetto.
Yeah.
I mean, if we're wheeling and dealing.
Good girl.
and dealing.
I'm just saying.
We cannot say that enough.
No.
Commissioner Smith?
You guys meet with them all the time, on issues. You kind of know when to push and when to back off, but, a lot of people been telling me sometimes it's good to push a little bit. As my colleague talking about that, even that third bridge, he was, are you pushing the right buttons to get it, or are you just talking? So I think you guys have been around long enough to know when to push and back off.
Okay.
Okay.
Think you hear us?
Commissioner Baugh?
Yeah, I think some of us here on the board remember, I think when Betsy and I were first elected, there was an issue that the board had with FDOT, and we worked very hard to get that relationship back. I know Carol and Betsy and I can't remember if Larry was there or not, but we all went to Tallahassee and had a meeting with FDOT. I know Rich Biter was there, you remember? And we worked very hard to rebuild our relationship. And, it's always good to have your partners. And I have found with FDOT that a lot of times, if you just sit down and you guys know better than I, if you just sit down and have an intelligent conversation, with them, sometimes that gets you further than anything else. And I think that's probably what we need to do.
And we work with them like we always do. They're great partners.
Absolutely.
I just know that it's out there now that road will be shut off, so any moment your phone can start ringing. That's what I really want you to be aware of. And we will continue to go back and talk to our partners.
Yeah.
Okay, great. What's next?
One more item, if I could go back to the presentation. As you are aware, and in just a moment, you're going to get the latest update on the University Parkway interchange design. And when the presentation first came from FDOT that they wanted to work on University and improve University, some of the comments from FDOT's consultants was there was concerns about failures of county local roads adjacent to the interstate, adjacent to the project. And when staff looked at those and took a closer look at what those concerns were, for the most part, the models that were showing failures were based off of 2040 volumes and projections. So in 2040, those roads would have some failures. So staff took that concern to heart and we took a look at what could be done adjacent to the interchange. Specifically, what's in front of you now is Market Street. There was, the proposal from FDOT was to limit some left turn lanes to meet that 2040 demand. We believe we have a solution that doesn't eliminate left turn lanes. What you see is kind of the grayed out areas basically show adding left turn lanes throughout the interchange at Market Street, and essentially adding a lane between Market Street and Town Center, so there'd be additional lanes there. At this point, mostly just wanted to show you and let you know that we were looking at that, and it goes in good coordination with FDOT's presentation they're going to give. We will continue to pursue funding for this project. We will probably make some requests through the MPO to add to this. You may see it a future CIP project, that kind of thing. But basically wanted to let you know that this is definitely on the county's radar. We still believe that the 2040 is when some of the failures were beginning to show up. And we believe that this design that staff has recently looked at from that addresses that. And so mostly just wanted to give you an update that we're aware of some of those and want to kind of continue to look forward to that. This is just a concept plan. Detailed design would still be needed. The red marks kind of show you where right of way is going to be needed to accomplish some of this stuff. So it's a full-blown project in and of itself, but you will hear more. So mostly just wanted to give you an update on that.
Commissioner Dodd? Oh, sorry, Ron.
Go ahead, Ron.
I spoke with Secretary Nandum. Every time I call him Secretary Nandum, he
I know, it's weird,
buzzes
isn't
at me and
it?
says, call me okay, you know better.
Yeah.
Secretary Nandum. We tried to partner now while they're in construction. It's just bad timing on, I think, our part mostly, because we do have the World Rowing coming. So what we don't want is continued construction while we have the multinational visitors coming through our beautiful area. So they're going to finish their project. It'll be prettied up. We'll have the World Rowing. As Saji says, and I promised the secretary that we would start pursuing design money so that we can, through the CIP, MPO, so we can get some fixes for the year 2040 as projected. So we will do that. But I told him, and he just asked me, would you pursue design money? I said, absolutely.
Mr. Bond?
Okay. Tell me something, because I'm not sure. Market Street, is that a county road or is that part of the stewardship?
It's a county road.
It is a county road. Because I can tell you right now, I knew this was going to come up. Ron and I had that conversation, and I can tell you that Market Street right now is a bear. I mean, I'm on that road all the time because I use several of the different locations there in that center, and it is a bear to get in and out of there. And it's not just because of the construction. I mean, it's always been a bear. I don't know how it was. Well, I'm not going to get into the design, but it does seem like on University, however, right now with the additional lanes that are there, the way it's conformed at this point while it's under construction, it does seem like getting into Market Street is much easier. It's getting out that is so difficult. And you talking about the World Rowing, I know I talked to Benderson not long ago, and I know they told me that Prince already has a contract that's been signed with them. As soon as they finish the DDI, they're going to start on, I can't think of it, it's not Cattleman. What's the name of that road? There where the fitness center and all is?
Cooper Creek Boulevard?
Cooper Creek. They're going to start on that. So I know they're going to go from, Prince is going to go from one project right into the next. So I didn't know if we were looking at trying to do the same on Market Street.
Bad timing, and they don't, there's some guaranteed bonus money completions that we might foul Prince up with, so we don't want to.
On the DDI.
Yeah.
Yeah.
If we add ours to it, it could mess up their bonus money as well, so we don't want to be involved in that liability claim.
Okay. Are we going to hear from FDOT today?
About the diversion dime, yes, ma'am.
Okay, thanks.
Just real quick, is there any possibility of getting rid of that funky pretend roundabout?
That'll be part of the design. That's why we need some money to go in and look at the design of this.
Weirdest thing.
Horrible.
Cooper Creek?
I don't know
Where
who
is it?
did that.
I don't know.
Well, it was a mandate of, this is what I was told, you can tell me if I'm wrong, it was a mandate because of the separation from the right-of-way, that you had to have that kind of funky interruption because they wouldn't allow it to be a free throw.
Where?
On Cattleman? I mean, Cooper Creek?
Market Street.
Oh, Market
We
Street.
have that
the
little.
worst.
I'm talking
Yeah.
Market Street. Now, they can keep all their roundabouts on Cattleman, they love them. But this, whatever that is called, it's not a roundabout.
I
but
don't
it-
know what that is.
It was my understanding that it was mandated because of the separation from the entrance ramp to the road. I mean, I heard that rumor a long time ago, but
No sense.
now we have a divergent diamond, which is going to fix every single problem with anything at the intersection, right? And then, so maybe we don't need this anymore, that funky.
Well,
It is funky.
the funky predates Ron and Saji and others, so, but we do know that that's private property.
There's a piece of it.
There's a piece of that, so that's gonna be, we'll have to purchase that and do some, it's all in the design. We're gonna press that pretty fast to get some design money so that we can make that improvement.
Great. Commissioner DeSabatino.
So we're going to next go to FDOT. So before that, I wanted to thank you all for, and thank Ed for having it down here, because there was so much valuable information that I knew you had that I just wanted to be able to preserve so we can go back and look, and the public can see all the hard work you put into it. So thank you for that. Thank you for the enhanced sidewalks in Televast. I know that was a big project, and then you added more sidewalks to the community center, so thanks for that. It was great that Woodruff has a lot of these contracts. They're local, and they're really a good partner. Really quick, not part of any of these, but going forward, because now you're going to be changing traffic at 44th. When you're on, now picture this, 38th Avenue East and 26th Avenue East, heading towards 301, there's no turn lanes to get to 301. So, and there's lights there. So when you want to turn on the 301, you have to sit and wait, and it backs up. Can someone look into that to see if there's any capacity to do a right turn lane onto 301?
30 is closed. That'll be closed.
No, on 30th and 26th Avenues. There's one that, there's the fire station right there, so I think that's a concern because there's two little lanes there. So it's 26th Avenue and 30th Avenue turning on to 301.
We'll take a look.
Okay.
Okay, because we're running out of time here, guys. We have the COG meeting. I was just trying to check the traffic going across the bridge on my phone, couldn't get it up to see what the situation is. So if anybody can check that and see if it's, if we've hit the gridlock hour yet. Okay,
While we're doing that, want me to introduce FDOT and they can.
please.
Put
So-
us all on a boat.
So next, we asked FDOT to come based off of the board's request to know what's the latest status for University Parkway and the DDI. And with that, I'll turn it over to Marlena Gore and she can introduce her team.
Good afternoon. As Saji said, I'm Marlena Gore. I'm the Interstate Construction Project Manager with the Florida Department of Transportation. With me today for the DDI project, I have the Senior Project Engineer Edwin Santana with Metric Engineering and Trudy Jarina with the Valerian Group. She's our Public Information Officer. But prior to us getting started, I know you have questions about Cooper Creek and Market Street, so I will bring up my boss, Nick Patel, who's the resident engineer for Interstate Construction, and he'll clear some things up with you.
Come on, Marlena, you know all about Market Street.
No, as far as, you talked about the improvements at Cooper Creek. My understanding is Benderson's hired Watson Civil to do that work, so,
Excuse me one moment.
yep.
It's flowing, but this announcement is only good for about 30 seconds.
Okay,
It's flowing good right now, but I wouldn't give it too much longer.
that's what I thought. Okay. Please, go ahead.
But Watson Civil's doing the work for Benderson onto Cooper Creek. Prince is doing some of the work on in the intersection itself, but the work that is happening on Cooper Creek is going to be done by Watson Civil.
Can I
I'm sorry, I honestly could not hear you. You said who was doing the work on?
Watson Civil.
Oh, I
Watson Civil, and what exactly are they doing? Aren't they just designing another through lane, or is another turn lane?
They're actually going to be doing the construction on Cooper Creek to do the turn lanes out there.
To do the turn lanes, but it's going to be an additional turn lane, I think, from
That's
having
correct.
talked with Benderson folks about what they were doing. That's what they told me, to try to solve some of the issues where you get that mix of the left turn and the people going straight. That's where on the southbound Cooper Creek at University, that's where the
That's correct.
problem is.
Yeah, I'm surprised at what you're saying too, because I actually was told that by someone at Benderson
Okay.
about Prince, so I'm surprised.
No, we're, go ahead.
No, I'm Edwin Santana. The project is going to add, it's going to widen on both sides of Cooper Creek. You'll have two southbound through lanes, the two left turn lanes that you have now, plus the right turn. So they're widening to both sides, and the northbound two lanes are going to be then wider, increasing the capacity. But actually, Watson Civil is the contractor. They're trying to get somebody to design the traffic control plan. Then it's going to go to a permit with the county for the right-of-way use so that they can get in there. We're anticipating 2-3 months before they start.
Oh, that's better than what I heard. Like
Okay,
it.
great, thank you.
Okay, I will quickly run through this. I know that you have another meeting to get to, so I won't be as lengthy as I normally am updating you, but so just to reiterate, our improvements are widening I-75 to an eight-lane highway, 3 through lanes with 1 auxiliary lane between Fruitville Road and University Parkway. The widening and reconstruction of University Parkway to accommodate the diverging diamond interchange pattern. We're adding additional sidewalks, bike lanes, and pedestrian walkways, drainage, lighting, and signalization. And then the noise wall north of Fruitville Road on the west side of I-75. The columns are in place right now, and the panels are coming in. We're looking at being done with that in the July timeframe. These are progress aerials that we take on a monthly or bi-monthly basis, depending on how much work has been done. So I'll quickly run through these for you. You've seen some of these already in previous presentations. That's the Acro Bridge going in February of last year. The southbound bridge has now been demolished and traffic has been diverted to the southbound bypass bridge. You can see the starts of the bridge deck on the southbound overpass. And the southbound overpass has been constructed at this point, and they're working on building up the roadway. And this is just before Thanksgiving. We had completed the roadway and the bridge deck, and we're just about to do the shift of southbound traffic. And there we are. This is the first week in December. We have shifted the southbound traffic onto the new I-75 roadway and bridge, and we have already demolished the northbound overpass of I-75 and starting construction of the new overpass. We did that in a week.
Wow.
There you can see the northbound work, or the northbound traffic is on the bypass bridge, and they're starting to install the center piers for the northbound overpass. Milestones to date on I-75. As you're aware, we had done the Acro Bridge, demolished the southbound bridge, and we have moved southbound traffic onto the new configuration. And this is a look at the new southbound overpass from the side, along with the MSE walls. Some other milestones on I-75, we completed the inside widening, which added the auxiliary lane in each direction between Fruitville and University Parkway. We've shifted the traffic into the final alignment on the I-75 ramps in all directions at this point. We've completed the widening of the Foley Creek Bridge, 2 northbound additional lanes and 1 southbound lane. We completed the widening of the Erie Creek Bridge, which is between University Parkway and Fruitville Road to the south. That was 1 lane in each direction on that bridge. Ongoing activities on I-75, we're about 75% complete with the nighttime paving operations of the structural course asphalt. And that's on I-75 and on University Parkway. Our ongoing activities is continuing construction of the MSE walls on the interstate, the ramps, and the bridges. The ongoing activities on I-75 on and off ramps, additional drainage, installation of the new signals and lighting. Again, the construction of the noise wall is estimated to be complete in July. The milestones to date on University Parkway, we've done multiple maintenance of traffic phasing shifts. I'm sure if you've been out there, you go home one night and you get up the next morning and we've shifted it on you. We've done that several times. That's progress. We removed the existing overhead trusses because of the widening of University, installed temporary signals, and removed the median. We completed the installation of the 36-inch water main, which was a joint project agreement with Manatee County. Our ongoing activities, extensive amount of stormwater drainage, piping, and structures. The intersection of Cattleman Road and Cooper Creek Boulevard, that's a hot topic right now. With the latest traffic shift on University Parkway, we have put the right turn lane to northbound Cooper Creek back as part of our phasing. That has eliminated some of the congestion we had on the southbound off-ramp at University Parkway. But with that, we had to do our next phase of construction, which was eliminate the right turn lane of southbound Cooper Creek to westbound University Parkway. That area is already very congested, and unfortunately, we're doing the best we can to minimize the impact. We're looking at hopefully being done with that entire intersection by the end of March, and continued cooperation and coordination with the Manatee County project to the north after that point. Ongoing activities also on the east side of the interstate at the Lake Osprey Drive, Market Street intersection. Continuing drainage, and we've started the drilled shaft foundations for the new mast arms that'll be going in at that intersection. We've completed a lot of the curb and gutter as well in that area. This is a quick time lapse of the east side of I-75 on the Lakewood Ranch side. It quickly goes through how we've been doing our traffic shifts from inside to outside and back to inside again. This is the west side of the interstate. This is just a couple weeks ago. We were finishing up the median area of the west side of the interstate on University, and we have since shifted. And this picture we kind of find humorous because everybody always complains about all the traffic. This is actually in the middle of the day on University Parkway. We just timed it just perfectly, so it looks like, you know, minimal traffic. So we laugh because it's like, why is everybody complaining? Okay, and overnight last week, we did the shift on the west side of the interstate, and those outer areas that you see in that picture have already been milled up, and the construction of the outer lanes has started. Implementing the DDI traffic pattern, this is a quick snapshot of what the interchange is going to look like after we implement the pattern itself. And our plan right now is a late spring, early summer implementation of the diamond itself. It'll be an overnight operation to limit the traffic impacts, which we have done in the past. It'll be a full closure of the interchange. We're looking at doing it over a weekend because historically we've found that that Saturday night into Sunday morning has the least amount of traffic. So if we have to push things a little bit that next morning, we're not impacting people trying to get to their work and school. The full detour will be implemented, which we, like I said, we've done before. And upon opening, there will be 5 lanes in the diverging pattern in each direction, which will have 2 more underneath that we're going to have closed temporarily because we need to construct that middle median area underneath the interstate. 6-month look ahead, completion of the noise wall, implementing the DDI pattern, completing the I-75 northbound bridge and shifting that traffic back onto the new pattern, removing the Acro Bridge, completing construction of the MSE walls, completing installation of the signals and the permanent lighting, curb gutter and sidewalk, and construction of the ponds. I'm going to skip through because I don't want to take up your time, but these are the time-lapse videos, and we'll be doing an update to both boards, Sarasota and Manatee County, in March, and you'll see these then, so. And with that, I'll bring Trudy up so she can update you on our community awareness.
Oh, sorry. Hi, Trudy Dorina, Public Information. I'm sure you guys already know about the website that we have, and you're able to go on there and sign up for updates, as well as receive text messages for detour routes and unexpected closures. The one thing we're going to be doing coming up is, prior to the implementation of the DDI, is we're going to do another public meeting to do some proactive outreach in the community. Some people may not be familiar. Some people might be a little hesitant on how they're going to drive this. So it'll be an open house meeting where you can come in the first hour and talk and look at boards, and then we'll do a formal presentation with questions and answers. Also, we'll be visiting some of the local retailers, and we plan on doing a kiosk at the mall for maybe a few days during the month where people can view the animation as well as pick up some informational collaterals. Also, continue to update through the website and our weekly e-newsletter. And with that, question and answers.
Okay, no questions? Good. I'm going to open it up for public comment, but I'm only going to give you 2 minutes. We got to go.
No.
We got to go. We're going to make it across the bridge for our 4 o'clock meeting.
Good luck. Okay, quickly. The medians on the interstate. When Florida was, when the interstate was first built, the medians were nice and wide. A lot of times there were trees in the medians, you know, and it really just happened as soon as you came across the state line. It was a great welcome. What's happened at University is a travesty. The median has been completely obliterated. And with this approach, it won't be long before it'll just be 12 lanes, just like the New Jersey Turnpike. I would like to recommend in the future, with these kinds of renovations and improvements, that the county look at increasing the right-of-way and hold these medians sacrosanct. They're really a wonderful invitation to the state, and it makes the road seem a lot less crowded even when it's crowded. Roundabouts. The county doesn't know how to build roundabouts. I'm not sure the state knows how to build a roundabout. If you go to the UK and see what England has done with roundabouts, you'll understand how roundabouts need to be built. We missed an excellent opportunity at 301 and 44th Avenue. That would have been a great place for a roundabout. Hopefully, the county can learn how to do roundabouts at Rye and State Road 64. Pedestrian bridges. The problem with pedestrian bridges is most of them aren't wheelchair accessible. I doubt these pedestrian bridges will be either. It would be nice to see an incorporation of a mindset that just included land bridges, maybe fewer land bridges than pedestrian bridges, that would serve for animals and people and be more handicap friendly. And finally, retention ponds on State Road 44. The contractor and the county government itself have really done a lovely job here on State Road 44. The only comment I would have on the retention ponds is, why can't we just make these small mini parks? And why can't they vary the depth of the retention ponds so even when it's empty, maybe a deeper part of it would still have some water in it? Thank you so much.
Thank you. Anyone else? All right, I'm going to go ahead and close this work session. Thank you all for being here. Sorry, but this is the way our week is going. Time to do anything.
Seems to be.
See you Thursday.
Back here again on Thursday.